it was a really easy decision to join Florida Cancer Specialists.
The part about FCS that really got me, I moved here from New York, and that was right after my fellowship. The fact that FCS was a company where you could not only treat with the most recent advances approved by FDA in treatment of cancer, but also have the ability to be part of clinical trials, and we have a whole lot of them. And the fact that we have a DDU, to me, that was just like a whole experience that you have as an oncologist towards treating your patients.
Florida Cancer Specialists has now grown to be, a huge organization throughout our state. And a lot of people who, find out I'm working there, they don't quite understand what is Florida Cancer Specialist. Is it a major comprehensive cancer center? And I explained to them, we're not a comprehensive cancer center in the idea that it's a huge building with a main campus, but it's almost like take that main campus and just spread it out through multiple smaller little campuses, and sort of that's what we are.
I joined Florida Cancer because it's an extremely reputable organization who has a breadth of clinical trials and opportunities available for cancer patients like mine, and has been a great opportunity to be involved with them.
There are many aspects of FCS that is very appealing to oncologists. One is there's a very robust clinical trial program. It is a very well-organized practice for physicians and also extremely organized for patients as well.
Among the things that attracted me to Florida Cancer was not only excellent clinical care, but also the research component. And having been at an academic center, that was really, really important to me. So in Sarasota, we're lucky because in addition to being able to offer clinical trials in the clinic, we also have our research colleagues that are exclusively focused on research through the drug development unit.
I think in this practice, it's still physician-run, and I think that matters, especially in this field, because we know what the research is saying, we know what the best treatment is. I know when I go to meetings, I meet with other doctors in private practices around the country, and they're like, oh, I would like to prescribe A, B, or C, but I can't because it's not on formulary or because I cannot do it. But at FCS, you really truly do what you think is best for your patient if it's in guidelines. So I think that's very important.
The great thing about Florida Cancer is that we have the opportunity here to really not only, most importantly, focus on patient care, but we have the opportunity to do that in a way where we're able to provide cutting-edge, state-of-the-art care, but actually be able to provide it locally, right? So patients don't have to travel somewhere else for their cancer care.
One of the things that drew me to FCS was the fact that we do offer clinical trials to patients here in our smaller communities like Vero Beach and Sebastian. Before this, we didn't have that opportunity, and growing up in this town, our patients had to drive probably on average 3 hours to partake in a clinical trial or any sort of research. And so the fact that we offer this here in town is such a blessing to the community and to our patients, that we have options that are at the forefront of scientific research and research in oncology.